Well, the Intermountain Transplant Program dates back to 1983 when we first began the kidney transplant program, and several years later, in 1986, we initiated both our liver transplant and pancreas transplant programs. And in fact, just this last year, we celebrated our 25th year anniversary of the liver transplant program. What really makes transplant happen is the donors, both living and cadaveric donor, which obviously we can't do transplants without the generosity of the families and of the donors to step forward and be willing to donate and take on a risk of themselves in order to help somebody else. We've implemented a lot of innovative technologies such as split liver transplants, living donor liver transplants, and kidney transplants. That's what excites me here. We are able, with experienced staff, to be able to successfully be innovative and creative in order to get more people transplanted. We have now transplanted over 3,000 patients at Intermountain. We're transplanting over 150 patients a year. As our waiting list grows and as more and more people are coming for transplant, I think the growth of the living donor program is really essential, particularly now in liver transplants. And so we are doing partial grafts, mostly in children, but we're also doing in adults now, where we would take half a liver from a living donor and transplant that into a transplant recipient. The liver is the only part of the body that actually grows back to a normal size, which only takes about 4 to 6 weeks, and that allows us to perform these kind of transplants. A combination of kidney, liver, pancreas, heart, bone marrow transplants. We're the longest standing multi-organ transplant program in Utah in the Intermountain area. We have the largest staff, and we're transplanting the most number of patients. We have the most number of patients on the waiting list. We're continuing to see our program grow as our reputation is growing, and we're getting more and more patients coming in from out of state and other areas of the country in order to receive care here.